Okay guys, now we will be discussing question number 55 from section A, and that will be the infrahyoid and the suprahyoid muscles. Now, the infrahyoid muscles are comprised of 4 muscles, and so are the suprahyoid muscles. First, we will begin with the suprahyoid muscles. Okay, let's go to page number 28 in the Netter's Atlas, and for some reason, I know the suprahyoid muscles really well because when I was studying the internal organs, part of the oral cavity, they came out quite frequently, so I never really forgot the origins and insertions. And in cranial nerves, because I know them really well, it was not hard to forget the innervation. So first, I think a good way to begin is start with the most deep muscle of the suprahyoid, which is going to include the geniohyoid. Okay, the geniohyoid, although it's not visible here, will be above the mylohyoid, which is right here, and above the mylohyoid, running this way, it will look like this. It will be right here. It looks kind of like a triangle, kind of like what's right here, and it will be running from the inferior mental spine to the hyoid bone. Okay, so for the geniohyoid muscle, the origin will be the inferior mental spine, and the insertion will be the hyoid bone. Now, the geniohyoid bone is going to be innervated by the anterior rami of spinal nerves. Okay, next, superficial to that will be the mylohyoid muscle. Now, the mylohyoid muscle is going to originate from the mylohyoid line of the mandible, which is more lateral, as you can see, and will insert once again onto the body of the hyoid bone. Then you have your digastric muscles. Okay, well, it's actually one muscle with 2 bellies. Okay, there's an anterior belly which will originate from the digastric fossa, and you have a posterior belly of the digastric which will originate from the mastoid notch, which is medial to the mastoid process, and also the superior nuchal line. Now, both of these bellies will insert onto a common tendon, which is visible right here. Let's get a closer picture. Okay, so you have your common tendon right here, and this should be located on the lesser horns of the hyoid bone. And just for those of you who don't know, the hyoid bone is composed of a body, your lesser horns, and your greater horns that continue a little bit laterally and posteriorly. Okay, so on your lesser horns, you'll have your intermediate tendon for the digastric bellies to insert into. Okay, and just a quick note, you see this muscle. If you can look very closely, you see that there's another muscle that's coming from up here and also inserting into the hyoid bone. So you see that the posterior belly of the digastric muscle is going to go through the, I guess, 2 heads of this muscle. And that's going to be your stylohyoid muscle. And your stylohyoid muscle will originate from the styloid process and will insert onto the hyoid bone. Okay. Now let's quickly talk about these innervations. The mylohyoid muscle is innervated by the nerve to the mylohyoid from the mandibular nerve of the trigeminal. You have your stylohyoid muscle, which will be innervated by the facial nerve, and you'll have your posterior belly of digastric, which will be innervated by the facial nerve as well, and you have your anterior belly of digastric, which will be innervated also by the nerve to the mylohyoid. And it makes sense because the mylohyoid muscle is right here, deep to the anterior belly of the digastric. And just a quick note, here would be your submental region, this would be your submandibular triangle, and so on, so on. Okay, now let's talk about your infrahyoid region. Now, the infrahyoid muscles are, once again, quite simple. You have your sternohyoid, okay, which will run from the sternum manubrium, and also the, I believe it's the uh, costoclavicular joint, and those will be the insertions. Once again, the origin is going to be the manubrium sternum and the costoclavicular joint, and it's going to insert all the way to the hyoid bone. Okay. Then you're going to have your sternothyroid. Okay. So most superficial, you're going to have your sternohyoid bone. Okay. Now, like as you see right here, now once you cut the sternohyoid bone, you're going to see your sternothyroid muscle. Okay. Sorry, correction. You're going to have, once you cut off your sternohyoid muscle, you're going to see your sternothyroid muscle right underneath it, which will be going also from the manubrium sternum, okay, and will insert onto the oblique line of the thyroid cartilage, okay, and then originating from the oblique line of the thyroid cartilage, you're going to have your thyrohyoid muscle, which will insert to the lateral 1/3 of the hyoid bone and the greater horns of the hyoid bone. Okay? And last but not least, you're going to have your omohyoid muscle. And your omohyoid muscle, as you cannot see from here, but your omohyoid muscle will originate from the superior angle or superior part of the scapula and will insert all the way to the hyoid bone. Now, the omohyoid will be divided into a superior belly and an inferior belly by an intermediate line. Okay, and that's it for your suprahyoid and infrahyoid muscles. If you guys could see the sternocleidomastoid, it would be coming somewhere here, and this would be the omotracheal triangle, and just a few of the triangles that we'll get later to in topography, but just a few triangles just to name off. Here would be your carotid triangle, sternocleidomastoid binded by the sternocleidomastoid, the superior belly of omohyoid, and the posterior belly of digastric. You should have your carotid triangle right here, which is basically known for the neurovascular bundle. The neurovascular bundle, enclosed by the carotid sheath, you have passing the vagus nerve, the common carotid artery, and the internal jugular. So just a quick heads up. But that's going to cover question number 55. Okay?